It's it's that you have different types of data from different types of studies, all of which can be biased. As I say, randomized trials can be biased. All studies can have biases. But if you just have a vast volume of studies that just repeat the same bias, then you will get the wrong answer. What's required is actually to think about how can studies have different biases. So let's think of randomized control trials of cholesterol-lowering drugs like a statin, and those randomized trials could be, they could be biased. It could be that when you give the treatment, that influences something else, which is in some contexts, which actually has the effect on the outcome. There could be biases in randomized trials, but then you have a Mendelian randomization study when it looks at genetic variants in the HMG co-reductase gene that relate to cholesterol level and predicts the difference in coronary heart disease risk. The Mendelian randomization study can be biased by genetic pleiotropy, which won't influence the randomized control trial. And a study which uses a negative control to actually sanity check whether it's whether the observational association is at least has some face validity in terms of being causal. If your negative controls don't show up biased, that would make you then weigh those studies more heavily. Other approaches are things like cross-context comparisons, where you deliberately go to situations where the contexts are different. So, for example, contexts can be different countries, different places where confounding is different. In studies in breastfeeding, we looked at in Bristol, even longitudinal study of parents and children, breastfeeding in 1991. It was the better mothers with higher education, families with better, in more favourable socioeconomic circumstances, different patterns of risk of health damaging behaviours, etc. Breastfeeding predicted everything. Everything good was predicted by breastfeeding. But if you went to southern Brazil at that time, that wasn't the case. It wasn't. Breastfeeding, still was not confounded in the same way. So you did studies between those two populations, and the things they agreed on were there. That you therefore had a greater faith in the things they agreed on. Yeah. So it's just always thinking of, is there a variety of evidence in this whole in the studies that have been done of this issue? Is there a variety of evidence? If there's not, then you think we need varieties of evidence to address this question.
Yeah, and I think what you just said is important too for sort of another or related reason, which is virtually everything in biology is context dependent. Our biology adapts different contexts. That's sort of what the essence of it is. And very often, when people are interested in medicine or diet or human health, some aspect of human health, they're often looking for something that is context invariant. They want a drug that will work for everyone, or in this part of the world or that part of the world. So that's just another reason why it's important to think about whether a result holds across different contexts.
Yeah, absolutely. And those are sort of situations actually where the genetics can be really helpful.